As a psychiatrist, I think it's particularly important to acknowledge a clear and shameful past in my field when it comes to race and racism. Historically, it's a sad irony that during the 19th century, while some enlightened folks were advocating for humane and compassionate treatment for the mentally ill, others were labeling a slave's desire to escape captivity as a mental illness. Other terrible legacies of racism in mental health include poor access to care, and when care was available, Black patients were often misdiagnosed and poorly treated due to lack of consideration of cultural differences, a callous disregard for the lived experience of Black Americans, and lack of Black mental health providers. It's painful for me to say it, but these problems still exist today. Black Americans and other people of color continue to have poor access to mental health care and suboptimal care in systems dominated by white people who don't fully comprehend either the effects of race and racism on mental illness or their own role in perpetuating feelings of alienation in their patients.
Radical healing means to me having equity and good health and long life for everyone.
Being able to have in the healthcare system persons that look like them, and that are able to treat them, are able to work with them, are able to understand some of the issues and some of the things that they're going through. So being able to have persons, the BIPOC community, no matter who they are, to really have a voice and to be at the table and making decisions.
It's important because when you treat the whole person, it takes knowing all of the needs of that person and respecting those needs in order to apply the health care. It's important because we need to make health care affordable and available to everyone, with everyone getting good quality of care.
Principle one, the first thing may be around educating. The second piece is around organizing, getting yourself prepared to do something, to make a difference. What is it going to take to do some really system changes that need to happen that will be able to address the BIPOC community and bring forth radical healing?
I am very grateful for this framework because it allowed us to bring more awareness, but also tangible applications to our healthcare system and to the services that we provide. This has been a long-coming initiative that will bring us together and will help us to deliver the services that people of color and people from marginalized communities deserve to have.
Beyond encouraging individual clinical providers to use radical self-reflection to bring about radical healing in their interactions with patients, families, and coworkers, leaders in academic health systems have additional responsibilities to promote radical healing. They must ensure that mental health trainees, medical students, graduate students, and other learners who are people of color have a positive environment in which to learn. This means that ensuring faculty and others they interact with treat them with respect. It also means that racist statements from patients are not tolerated and that the institution develops patient codes of conduct that clearly convey what it considers unacceptable behavior.
Wherever you are in your organization, I think it would be great if you would just allow us also to be able to come and share with you what this whole platform around radical healing is. And then from there, help your organization to be able to look at and see and evaluate where you are and how do you get started.
We can start by going into communities and talking with people, having town hall meetings, meetings at churches, and even going door to door.
So radical healing for psychiatrists starts with acknowledging this painful legacy, as well as the potential for the current mental health system to cause patients and families to experience disconnection from their providers. Beyond demanding an acknowledgement of the effects of racism on care, radical healing then places the onus on individual clinicians and managers of clinical systems to examine their role in perpetuating race-based interactions that impair mental healing. For white mental health providers, this process leads to difficult but essential conversations with people of color, fellow clinicians, office staff, and even some patients to learn about their lived experience and to seek to understand further how our interactions rely on assumptions rooted in racism. In addition to education, academic health centers support research, and it's just as important that people of color have access to participate in research, that they're treated with respect when they do. In my department, we've conceived racism as a form of trauma and have created ARTIST, the Anti-Racist Trauma-Informed System Transformation Group. This ARTIST group is tasked with examining the department's clinical, educational, and research activities and making recommendations on how we can identify and address issues in which racism may play a role. We will incorporate principles of radical healing as we seek to improve our clinical environment, our teaching, and our research.
Because we need to introduce new solutions into healthcare and keep progressing with self-determination and resilience.
To look at ways in which we can educate ourselves, educate others, so that we're all, continuing to move towards this radical healing and really adopt that in all facets of every organization, of every system, of every policy that is even developed and made.
Do what you can with all you have, wherever you are. Let's try to do this together, and let's try to keep making a difference.